So, good afternoon, distinguished ladies and gentlemen. You are all welcome to today's program, Tackling Dysbiosis, the Role of Yeast-based Probiotics. My name is Godfrey. So, good afternoon, ladies and gentlemen, distinguished ladies and gentlemen, and partners in healthcare. My name is Godfrey Mentalson Jr. I'm going to be your moderator for the day, and welcome to today's program that is talking about tackling dysbiosis. Now, for everyone who has joined, thank you so much. I think that the day that you've been waiting for is finally here, and we are very, very grateful for joining us. Today's program is a three-tiered program. The first part will talk about tackling dysbiosis, the role of yeast-based probiotics. The second part, we look at the role of S. boulardii in the management of dysbiosis and its related consequences in children. And the third part, I will just keep it as a secret, where there will be a very grand unveiling of a very wonderful product for that. Okay, so if you've just joined us, before I even introduce our facilitators for the day, please, in the course of the program, if any questions come up to you, you can kindly put your questions in the chat box, and that after the program, that is after all the facilitators have finished their presentation, then we'll have a very wonderful question and answer time. So that is one of the rules of engagement. Please put all your questions in the chat box and they will be answered at the end of the program. So what are we going to talk about today? As you already know, today the objective is very, very, very simple. We're going to delve into what dysbiosis is all about, the causes of dysbiosis, and we also look at what is the implications of dysbiosis, even on gut health and overall health in general. And then, like I said, we will introduce to you a novel product that is used in the management of doing that. The first part of the program, which is about tackling dysbiosis, the role of yeast-based probiotics in GIT, will be handled by one of the renowned practitioners in the country. I always get excited when I'm coming to introduce him, but you know what? There is a little bit of twist when you're introducing a person like that. When you get a CV, there are so many things you want to ask yourself. Which ones do you skip? Which ones do you say? But then, ladies and gentlemen, I want to introduce our first speaker and facilitator for the day. That is Dr. Adwoa Afrakoma AJ in Cancer. So Dr. Adwoa Afrakoma AJ in Cancer is a senior lecturer at the Department of Medicine and Therapeutics. That's the School of Medicine and Dentistry at the University of Ghana. He's also a consultant physician and hepatologist. Dr. Adwoa AJ is a woman who is very, very, very well noted and learned. Yes, for example, she completed University of Ghana in the year 1999. Dr. Adwoa AJ scooped almost all the prestigious awards during her time. She won top award in pharmacology, clinical medicine, and medicine and therapeutics. Apart from that, Dr. Adwoa AJ also has undergone several training from reputable schools or institutions like the Harvard Medical School, where he did a training in gastroenterology. He's also a product of the Royal Commonwealth Medical Fellowship, where he did a course in hepatology. Yeah. And he's a member of the Royal College of Physicians. Yeah. Dr. Adwoa AJ also is a member of several reputed bodies like the Ghana Medical Association, European Association for the Study of the Liver, the GASLID, and the Ghana College of Physicians. He is someone who has written a lot of articles and book chapters, and he has future research aspirations on liver cancer, fatty liver, and HIV. So I can tell you for sure, she is the best person to talk about, or one of the best people to talk about conditions like this. And when you wake Dr. Adwoa AJ even from her sleep, you are rest assured that she's going to unpack so much nuggets with regards to gut care or gut health and anything related to the GI. So ladies and gentlemen, let's welcome our first facilitator for today, Dr. Adwoa Afrakoma AJ in Cancer, as she talks about tackling dysbiosis. What is the role of yeast-based probiotics in GI? So Dr. Adwoa AJ, we are all ready to drink from your knowledgeable cup.
Thank you very much, and I'm humbled by those words. I'm simply Adwoa, a Christian. So today we're going to talk about gut how we tackling dysbiosis. Now, to understand dysbiosis, at least we need to know what it is, um, whether it's beneficial or not, and then we also want to know um, why there will be dysbiosis. Once you hear dys in medicine, it means that there's a problem. So, why that problem, and how do we solve that problem? So, per my outline for the presentation, I'm going to give you a brief evolving knowledge with regards to how the gut microbiota develops, its functionality, and its relation to a healthy gut. And then, if this is what is happening, then we ask ourselves, in which ways are the microbial community perturbed in this biotic disease state? And then, how do we restore it back to healthy composition from the dysbiotic states? Now, in terms of knowledge, we all need to understand when we talk about gut biome, we are looking at both the bacteria, the viruses, the fungus that come together, live together in a harmonic and dynamic equilibrium in the intestinal tract. If we have to extrapolate, it's like a man and a woman coming together with their children, male and female, living together in harmony and then moving about. That is the house biome. And this is when we have the bacteria, the fungi, and then the viruses, then we have the gut biome. Now, the gut biome and its genes that are produced together, when they coexist with that of the host, then we call it a microbiome. Micro because they are cells or genomes, they are microscopic and you can see with the naked eye. Now, sometimes when we look at the whole body, it looks like we are more bacteria than human beings. Because when you take a healthy adult, it harbors over 100 trillion bacteria in the gut alone. It hasn't accounted for those on the skin, those in the mouth, those in the eyes, the nostrils, in the ears, etc. And this is 10 times the number of human cells we possess. So if the gut is harboring this amount of biota in it, then we can agree that yes, we are more bacteria than human. Then when we look at our human genomes or genes, we have 23,000 genes as humans. But when you take the genes of the microbiome, it contributes about 3.3 million, which is so high and about 150 times larger than the human genome. So we can say that we are more bacteria than human. No wonder as soon as we die, we get rotten and then we are eaten up. The interesting thing about gut biome is that they have a good relationship, a symbiotic relationship. You help me, I also help you. You provide food for me, I also protect you. And this symbiotic relationship helps to keep the less beneficial strains or the harmful strains at bay. Now, if you look at the healthy gut, if we have to weigh, it weighs about 2 kilos. And the gut biome plays important role in promoting and in maintaining the daily human body functioning. So if we can function well as human beings, then our microbiome should be normal. If there is any change in the microbial community, then this can lead to gut related issues. And sometimes not only in the gut, as you will see along the way, it also affects other organs and leads to other organs related disease. So if you look into the intestines, all these people you are seeing are like the microbiota of the gut. And then we say that we are more bacteria than human. Now, looking at the structure and how big it is, some people have actually described the microbiome as a human another organ, which is made up of 4 major organisms: actinobacteria, bacteroidetes, firmicutes, and proteobacteria. These are the major, but there are lots of these microbiomes They are organisms that live in the intestines as a family. And now, when we take it, like in terms of the gut, we have the ruminococcus, we have the bacteroides, we have the firmicutes. Now, as we come down the intestines, the level of oxygen in the environment reduces. So by the time we get to the colon has the lowest oxygen in this environment. So it actually supports anaerobic bacteria like the Streptococcus, Bifido, etc. Now, because they are so numerous, they prevent others from attacking us and they have a protective function. The other thing is that even the food, they will consume all the food, and predators or harmful organisms that find their way in the gut are not able to establish themselves. Again, they have lined the inner aspect of the intestinal wall such that even when you come as an organism, if the normal flora is not distorted, then you can't even attach to the mucosal lining of the gut. And some are able to produce important antimicrobial proteins that deters other organisms from establishing themselves in the intestines and other places to cause problems. So if we take the organs, we have the lactobacilli in the small intestines, we have the enterococci, the lacto, and as I said, when we come down, then the anaerobes are higher. So when we look at the lumen, so this is the lumen of the intestine, and it is just separated by a single layer of mucosal cells. So one of the functions is that the gut microflora acts like a gate or a barrier to protect this lining so that the organisms do not have access to that single layered cell to go through to cause the infection. And that's one important way by which the gut biome protects us. Now, how do we get these gut biome in us? There are three main ways. At and during birth. Diet can also tell us the composition, how our gut microbiome should be. And then we also have environmental factors, where we have external factors like outside environment, the hygiene, and then internal factors like the pH, the oxygen saturation, etc., that are occurring in the intestines. And now we'll take the first one, which is now we have two schools of thought, but people, the A is what most people think that look, as a baby in the womb, there's no microflora or microbiome. Now, during delivery, as the baby passes through the birth canal of the mother, then it gets exposed to some gut microbiome in the passage. And that is where, within the first month, the microflora or the microbiome is established. So, if you take a baby within the first month, the type of microbiome depends on the mode of delivery. If you were delivered vaginally, then you are like taking all the things in the birth canal until you come out, compared to somebody who had cesarean section. For cesarean section, your exposure is the gut flora around the skin. So the staph aureoles and all those things start as your microbiome. So I was thinking about this and I asked myself, but now fathers always doing this paternity test. Mothers in the first month can therefore also determine or ask to do a maternity test where we take a swab of the canal, look at the organisms there, and look at our baby, the gut flora there, and see if it matches. Then we know this is our child or not. Well, maybe that is a thing that is going to occur in future. We come, so prenatal factors, okay, account for the microbiota that we have. Neonatal factors, as we have said, the mode of delivery, even the gestational age, the mother, features of the mother, the genetic makeup of the mother's canal, whoever, then the delivery nurse, the midwife that touches the baby, what flora is she introducing it to? If it's the father touching the baby, what's flora or what's micro. It also influences the environment where you were born. If we are born in a neat place, etc., your gut biome will be different from somebody who was born in not so clean an environment. The mother's food diet also influences her microbiota. So that can also influence the child's microbiota. And as the child increases, the mode of feeding also determines the type of microbiota, whether breast milk or formula. So if it was mainly breast milk, then your microbiota will be different from somebody who was fed with formula. Your geographical location. So let's say that you were born and you grew up in Choco. Your flora will not be the same as somebody who was born and bred around East Legon. Your family members will also, people you interact with at home, also can affect your microflora. And then maternal diet and weaning, the type of food. So right from breast milk, then they start you on serious fufu and something that also determines your microflora or microbiota. So, in the early stages, as one passes through, it may be colonized by proteobacteria, E. coli, enterococcus, and then around 6 months, where most people will be on breast milk, human breast milk, so they may have the oligosaccharides. And when you look at them, they may have your obligate anaerobes growing, and then they are rich in firmicutes and bacteroidetes. We're going to talk about this later. And then as they grow, it changes a bit depending on the type of food they eat. So there is diversity right from birth as in towards aging as the person grows older. So now what they have realized is that people who were born, okay, vaginally tend to have lots of lactobacillus, Revotella, and then the Snathia species. And those who have cesarean section, Staphylococcus, Corynebacteria, and then Propionibacteria were the main thing that were found at birth and within 1 month. Now, with time, as they age, enterobacteria is added, bifidobacteria, etc. So depending on, as we said already, the food that is introduced, the environment, etc. Now, the important thing here is that let's look at what happens when they become adults. Now, depending on the balance, this is the bacteroides and then the firmicutes. Now, depending on the ratio, it gives you an idea what risk factor or what the person may develop as an adult. So they have found out that research shows that if your firmicutes and B fragilis are all low, okay, then you are at increased risk of developing Crohn's disease. And this usually occurs in people who are uh, practicing pure hygiene. And from here, one of the things is that we will leave home will be at least take some bacteria as you go along. Then, if you have more of the bacteroidetes than and then a high firmicutes, then you're at increased risk of developing obesity. Now, if the bacteroides is low, they are prone to having allergies, okay, or excessive use of antibiotics in addition, then these patients are prone to allergies. So this gives us an idea the important role the microbiome or the gut biome is able to influence disease in both childhood and then in adulthood. Now, this was comparing breastfed babies with bottle-fed babies and looking at their indigenous microflora. And for breastfeeding, it was primarily bifidobacterium. And the advantage of that organism is that it has a lower pH, less buffering capacity in the large intestines, so that it disfavors the presence of enterobacteria. And then it also competes with very important organisms which potentially can cause disease like C. diff, Clostridium difficile, which can cause chronic diarrhea. Now, the other thing is that those who had bottle fed, so breastfeeding protected them from C. difficile, even in adulthood, compared to those who were bottle fed. Because if you remember, bottle fed people, they tend to have more Clostridium, the Staph, the Strep, Lactobacilli, and they were 4 times likely to have C or to harbor Clostridium difficile compared to the same age-matched people who were breastfed. So that tells you the importance of breastfeeding your children instead of bottle feeding them. Because once they have this, they also have increased risk of developing allergies, asthma, etc. as adults. So now we look at the intrinsic and then the extrinsic factors that can contribute to the disease. Okay, so the intrinsic factors, the acid, the oxygen, we're looking at the motility. Whereas with the extrinsic factors that can influence our gut bio, we've talked about the importance of diet, the taking probiotics, and the PPIs that we take. The proton pump inhibitors actually disturbs the intrinsic factor, the pH, making some of the beneficial organisms not able to. So we should not abuse these drugs. The same way antibiotics, a little cough antibiotics. Remember that anytime you use antibiotics, you are distorting the normal flora, which is protecting you, or the microbiome, which is protecting you. So let's use it when it is necessary, looking at the duration of it as well. The use of prokinetics can also affect that, and then some NSAIDs can also affect that. Now, what about diet? We've learned that breastfeeding is more protective than bottle feeding. Then, as an adult, it's also been shown that most of diseases as adults, they'll tell you diet, obesity, diet, hypertension, diet, asthma, diet, cardiovascular diseases, check your diet, GI diseases, check your diet, rheumatology, it cuts across every subspecialty. Stroke, look at your diet. So diet plays a significant factor because it's associated with both health and disease control. Now, one important thing is that the gut biome, okay, can help produce and grow and give the microbia, the microorganisms, the community a very conducive atmosphere that they can be to help protect the gut. And we all know that carbohydrates are essential and significant energy source. And therefore, but however, we will look at the effect of excessive carbohydrate on the gut biome and its risk in diseases. And intestinal microbiota, if right diet is taken, it's very helpful because it ferments some of the things we cannot ferment. For instance, like the cellulose, the hemicellulose, the intestinal mucus that are produced, the body cannot break it down. But our microflora or the microbiome are able to work on it to give us energy. So if you have a lot more of the organisms that produce these substances that helps in producing energy, it can also affect the patient. So it's always important that a balance is key. Now, long-term diet, it has been known to be associated with some enterotypes. For instance, people who take food that are high in animal protein and fat then tend to have high levels of bacteroides, low levels of Prevotella. And those who take high carbohydrate diet, but minimal, you see a banku, big banku, and then the head of the fish. So that is high carbohydrate, low animal protein. And they tend to have high levels of Prevotella and then lower levels of this bacteroides. Now, when they looked at microbiota of African children, it showed that they had high bacteroides, meaning that the carbohydrate intake is very high, but their firmicutes were depleted. And so they produce lots more energy because of the presence of the bacteroides. And what happens is that it leads to obesity in these type of people. That is why most Africans, we are kind of round compared to Caucasians whose diets are a bit different. So this study was done in Italy, looking at Italian children who lived in a city and then some children from Burkina Faso. And the children from Burkina Faso, their main food was polysaccharide, carbohydrate dense diet. And what they found out was that If you compare their firmicutes, these are examples of the gut microbiome, and then they are bacteroides. So we say F over B. For the Italian, it was 2.8. And then for the Burkina Faso, the African, it was 0.47. The higher your ratio, the less likely you become obese. And so they noticed that these children were more obese compared to the Italian children. And it's all because of the polysaccharide rich food they were taking and the type of microbiota they had. So now, these are the things we eat. Energy dense, if you look at the fufu, bacteroides, it's very high. Kofi Brookman, the same thing. Look at Wache, the same thing. Gobe, we like gobe, the red, this. All these are polysaccharide rich, okay? And therefore, it increases our bacteroides. And this increases our risk of developing obesity. So now what do we do? Should we move away from this and then go more to more of leaves, the salads, the vegetables, etc., because that is where we are all being admonished to go. But I tell you, it is not easy. If you have to leave this fufu and go for this bread, it is not easy at all, but it helps. Now, there's been series of investigations done to look at diet and then diseases because the diet can cause dysbiosis. And for foods that are high, low FODMAP foods, okay, increased actinobacteria, and the high FODMAP diet decrease the abundance of bacteria. And one important thing is that the high FODMAP, because of the decreased abundance of bacteria involved in gas consumption, it usually results in bloating. That is why the high FODMAP foods for patients with irritable bowel syndrome, when we say FODMAP, example, it's fermentable oligo, di, mono, and polysaccharides. And these kind of foods tend to worsen the IBS condition because the organisms that will absorb or that are involved in gas consumption are reduced. And therefore, patients may feel bloated, they may have excessive belching or excessive flatulence. And so, in managing patients with irritable bowel syndrome, one of the recommendations is to use a probiotic, something to help stabilize the dysbiosis that is ongoing. The same for cheese and other foods as well. So, in a nutshell, what I'm trying to say is that the microbiome is very, very good because of its protective functions and its metabolic functions and structural functions. When we talk about the metabolic functions, if there is gut eubiosis, meaning that there's a balance between the good and then the bad ones, then what happens is there's low risk of cardiovascular disease, low risk of obesity, low risk of type 2 diabetes, even in hypertension. It's also been anecdotal studies in rheumatoid arthritis, in osteoarthritis. Almost every system can be affected. So when you look at this, so the gut microbiome increases certain factors that protect us and then reduces some. So one of the things that it reduces are the inflammatory mediators, pathogenic colonization, and gut inflammation, and then body fat deposition. So if you have a gut biome that is balanced, then you are in good health. Once there's disbalance, all these things I'm talking about goes haywire and can lead to problems. Now, the other important thing is like the chairs that musical chairs. So the gut biome have this barrier or competitive exclusion effect. They kind of protect so that no pathogenic or enteroinvasive bacteria can invade the mucosal lining of the intestines to cause disease. Once they are balanced, they are able to do that very well. So the bottom line is when you have a more diverse gut biome, then it means you have a healthier gut microbiome. And how can we do that? We should stop constantly assaulting the microbes by always taking antibiotics. We take it when needed, but unnecessary use of it can result in problems. Sometimes we have an overly sanitary conditions. As for me, I'm a very clean person. I don't want to see any dirt. That can distort your microbiome. And then our lifestyles, okay? Sometimes we have separated ourselves from nature. Everything we want artificial. Even if there is orange, we prefer going to buy bottled uh, flavored drink, orange flavored. Meanwhile, we are close to nature. So we need to take the natural things because that is what helps to maintain our gut, especially the balance between harmful and then the better promoting gut microbiome. Now, so here I ask myself, is gut microbiome a friend or a foe? It is a friend when it's balanced. Once there's imbalance, then it becomes more of a foe. So it may cause disease directly or indirectly when the balance is perturbed. So we always need to make sure that the host microbiome alignment is always balanced. So when it is not balanced, we say there's dysbiosis. And dysbiosis means a microbial ecosystem where the bacteria no longer live in a mutualistic association. It's the same as like divorce. I'm surprised they all start with a D. Like you have husband and wife who can no longer live in mutualistic association. And then it leads to dysbiosis. And what will cause that when there's damage or imbalanced gut flora, when there is leakage, okay, and when this happens, it's very difficult to eradicate. So basically, this is telling us how the balance is. The balance means that the beneficial or commensals are more than the harmful ones. Okay, compared to the tilting when the harmful ones are more than the beneficial ones. So this is what we mean by dysbiosis. And dysbiosis can lead to lot of diseases, the GIT as well as the extra intestinal disease. No wonder no, Nobel laureate Elise said that the majority of diseases begin in the digestive tract. And this occurs when good bacteria are no more able to control the bad bacteria. And this is what we call dysbiosis. So, depending on how the gut is, when there's dysbiosis, it leads to disease. When there's eubiosis, then there is health. So, we need to make sure that we always have the balance in the gut biome because we've talked about the roles and then it actually affects everything. The gut brain axis. Do you know that if you be happy, it comes from the tummy? Okay. Now there's an old adage where our parents were telling you the way to a man's heart is through the stomach. The way to a good health is through your gut. Anxiety, stress. Now, one of the enzymes or one of the hormones that we call the happy neurotransmitter is the serotonin. Where is serotonin found? It is found in the stomach, in the gut. Its highest component, about 95%, is in the gut. So your happiness is in your gut. Once you distort that, then anxiety, stress, depression, autism, anger, etc. starts. The same way, we also have the gut brain endocrine axis. And when that is distorted, then you have hormonal imbalances, you have increased risk of developing diabetes. We have also the gut lung axis. And if that is distorted, obstructive airway disease, gut liver. So if you're a gastroenterologist, it means that you are on overall, because just one topic of dysbiosis can explain all the symptoms occurring in every system. So, cardiovascular disease, there's high risk of atherosclerosis, there's the CNS, Parkinson's, depression, hypothyroidism, sarcopenia, rheumatoid arthritis, inflammatory bowel disease, IBS. All these may be as a result of gut dysbiosis. Now, when the gut turns bad, then diseases will happen. And for instance, one condition is the IBS, which is associated with gasiness or bloating. Maybe you may have constipation, diarrhea, or abdominal pain. And now we are seeing increasing numbers of patients who are coming in with gasiness, bloating, abdominal pain, either diarrhea or constipation. And one of the main things in managing this patient is through the animal model, is the trying to restore the microbiota. And this is where we actually have to move from westernized diet to agrarian diet because it's been found to be helpful. Now, so microbiota should be part of the management of patients with irritable bowel disease. And the same way, because Crohn's disease, ulcerative colitis are also associated, then it's also important that in IBD, the probiotics are also indicated to help restore the dysbiosis. We've talked about the hygiene hypothesis. Okay. Now, colon cancer. The same way, dysbiosis have been known to be associated in patients with colon cancer. And therefore, one of the things people are trying to indicate is that if we find that early and we give them something to stabilize or move them from dysbiosis to eubiosis, is it going to prevent colon cancer? And that is studies, there are lots of studies ongoing in that area. Then we have the gut flora. Once there's leakage because of massive ascites, the integrity of that single layered mucosal cell membrane is distorted, and therefore organisms can move, harmful organisms can move into the systemic circulation to cause disease, all because of distorted gastrobiota. Another important thing is gut microbiota, when it's distorted, can result in obesity and type 2 diabetes. Now, we all want beautiful skin, but beauty truly starts from the inside out. And sometimes when we make that statement, what we're trying to say is your character, yes. But I must also say that if your skin will be beautiful, if you be beautiful, it depends on the gut flora. You can use all the things in this world, skin success, skin promotion, skin this, skin that. If your gut biome is distorted, then you will not have a beautiful skin because the gut biome plays an important role in the appearance of the skin through making sure that inflammation is reduced, oxidative stress is reduced, good glycemic control, every opportunistic infection that will lead to abnormalities in the skin can be controlled from the gut. And therefore, your microbiota is your health. Now, this is the gut brain axis, where when you have problems with it, even sometimes when you see food, just the sight of it, something immediately you would want to eat. And that's the brain sends signals, the gut sends signals to the brain. Hey, do this. I'm hungry. Meanwhile, you have eaten. Somebody is eating, you feel hungry. That is an example of the gut brain axis. They are in constant communication. Okay, even if you see something that is fearful, it starts, it starts from there, and then you start your running. So the orchestra they were saying was the pituitary gland, but today I think from the gut microbiome, the orchestra of the function of the body comes from your gut. Obesity is also been known to be associated with dysbiosis, and obesogenic gut microflora has been found because these are patients who produce lots of butyrate, and butyrate will break down even the cellulose, etc., to produce more energy in the intestines. So your gut biome again can cause you to either gain or lose fat. So this slide is very clumsy, but it gives you an idea of all the diseases. Almost every disease you can think about has some association with gut bio. Okay. So all these and more of the diseases we have talked about are coming from a damaged gut flora. Then it tells you that, Charlie, these guys are really, really important. And if they are important, what can we do to preserve them? So there's been a paradigm shift. Now, anytime we talked about bacteria, we are thinking, oh, it's well known that it causes infection, it's well accepted, and there are known treatments. However, we are blinded by the fact that the microbial ecosystem also is important if we need a good health. And once we restore that, then it can help. Some of the infections, per the papers I reviewed, can be mild infections, can be treated when the gut biome is actually. So now the scientific community has recognized the importance of maintaining an eubiosis if we have to maintain a healthy status. So they've come up with probiotics, prebiotics, symbiotics, phage therapy, fecal transplant, bacterial consortium transplantation, and all these are to help us regain our microflora. So there have been therapeutic modulation of the gut microbiome right from the cradle to the grave. And there are different mechanisms, different things that helps probiotics that do help us. So now people are thinking that a time will come when we use good bacteria as drugs, okay, to replace the pathogenic ones. And once they form the short chain fatty acids, like the butyrate, like the propionate, like the acetate, these help fight the infection. And then it also nourishes the mucosal lining of the gut and supports the blood supply of the intestinal wall. So, how are we going to treat these? One thing that came up a few years ago was using stool as medicine, and this especially in patients with Clostridium difficile and patients with refractory diarrhea, where the main component of the stool they were using, they harvest stool from people, and then they are able to isolate the important normal flora or the gut bio. And this one they give to the patient. This was first performed in 1958, and it was very effective in somebody or people who were having recurrent Clostridium difficile. What did they do? They pass an NG tube after they have prepared the feces from a patient, a normal patient, okay? And then they pass an NG tube and push in the stool, okay, which is liquefied. Or they can give it via animal colonoscopy depending on, and they notice that it's slightly improved with antibiotics, okay, before the microbiota. But when they gave this thing, most of them resolved. So it was reported again that patients with ulcerative colitis, they did the same intestinal microbiota transplantation. And for the 6 patients that they did, they responded very well. They were in remission from 6 months to 13 years with mucosal healing at endoscopy. So this again hammers the importance of microflora. Again, fat loss trial, where patients with metabolic syndrome were given some form of probiotics, okay, to help them, and most of them responded by losing weight. Now, Crohn's disease, the same way, intestinal microbiota transplantation. But we ask, where are we going to get the stools to do that? Now, this is another study that was done. And what they did was that they picked a normal slim person and an obese people who were trying to lose weight, but for years they were not able to. So they transplanted some of the gut biome of these patients into the obese people. And the study showed that there was much improvement. They lost some weight. So your microbiota also determines your shape. Now, when we talk about microbiota, most people think that it is only bacteria, but the gut biome is made up of bacteria, is made up of fungus, is made up of viruses. And therefore, the human biome contains bacteria, fungi, and archaeal species. And the most common, when we take the fungal, yeast is the Saccharomyces boulardii. And there's been lots of publication on it. Its indication in acute GI disease like the rotaviral infection, bacterial diarrhea infection, also chronic diarrhea, such as occurs in inflammatory bowel disease. So if you have an acute gastroenteritis or acute diarrhea, persistent diarrhea, chronic diarrhea, the yeast-based microbiome has been found to be very good. Now, what is the advantage of that? It has been observed in about 96% of samples when they did studies. And then there are different strains. One common strain is the Saccharomyces cerevisiae. But what they have found, this is found in beer, in bread, and then other fermented foods and beverages. This particular one has very minimal benefit to the host. And if there is the need for host, then is the Buladi that works for patients with diarrhea. One, it is resistant to gastric acidity and is able to move with the antibiotic. And so patients who are on antibiotic can take the fungus. And then when it's taken orally, it is easily eliminated within a few days. And this is also an advantage because once you give it, there's high concentration in a very short time. It does its work and then the body gets rid of it. And it's also been known to be very good in, especially when you're going to give antibiotics for some time, because it distorts it causes dysbiosis. The other advantage is that it's able to produce lactic acid and vitamin B, and this helps to prevent proliferation of other harmful fungus that may develop. So a study was done where this was given to IBS patients within 4 weeks, and they noticed that there was significant reduction in patients who had the IBS diarrhea predominant type. So it was recommended that for patients with diarrhea predominant IBS, this yeast-based microbiota is of essence. Now, when we talk about probiotics, prebiotics, symbiotics, we need to be careful what we give or accept as a microbiome therapy, because it may be a wolf in a sheepskin. So, recognizing the therapeutic capacity of this intestinal microbiota is very exciting. If I can change my microbiota, improve on it to reduce weight, to prevent cardiovascular disease, renal disease, almost every disease, then it also comes with some responsibility. So I'll end by quoting what Hippocrates, after many years of practice, almost his whole lifetime of work, Hippocrates concluded that all disease begins in the gut. And I can't agree with him more, that all diseases start in the gut. And when we stabilize or tackle the dysbiosis, many of the diseases may be a thing of the past. Thank you very much.
Thank you so much, Doc. That was a very insightful presentation. I will just encourage each and everyone on the call, please, you can post in your questions in the chat box. Like I said earlier on at the beginning of the program, all your questions will be answered at the end or at the tail end of the program. So you can kindly do that. Let me share with you some of the things I picked before we go on to the second presentation. Number one, doctor asked the question that are we more bacteria than human? And he made the point that there are about 100 trillion bacteria just in the gut alone. So look at the whole body with only 100 trillion in the gut. Then he says that, yes, we should have a very, very good relationship with our microbiome. You feed it and it protects you. Yes, doctor talked about the gut microbiome and how it is formed. He talked about three things. Number one, that is during childbirth, and that is how Samuel picked it. He also talked about diet and even also looked at external factors. I was very interested, or it was very interesting when doctor raised the issue about maternal or maternity test now, because of how gut microbiome is passed on to children during birth. Yeah, and another exciting part was how gut microbiome for people who give birth naturally, or that is vaginal birth, as against those who do CS. So that was also a very interesting one. Then doctor also gave about 3 functions. Yeah, he talked about the fact that it gives the metabolic functions, structural functions, and protective functions. And he said that a good microbiome is good for even for your skin, for obesity, and all that. So these are some of the pointers I picked out from doctor's insightful presentation. One other thing that came out was the microbiome and its presence in children. As doctor was saying that, yes, the microbiome is formed when children are being given birth and they take over from their mothers and all that. So we also need to look at it from the angle of the children. So we're going to have another presentation that talks about dealing with the consequences of dysbiosis in children. So, and to do that, it's another very learned person on the show today. We have Dr. Taiba Jibril Afa. Dr. Taiba Jibril Afa holds the enviable position as one of the only 2 pediatric gastros in the country. He's a fellow of the Ghana College of Physicians, a fellow of the West Africa College of Physicians, and currently serves as the head of the Pediatric gastroenterology unit at the Kolebu Teaching Hospital. Dr. Taiba also serves as a consultant pediatric gastro at Leicester Hospital. So Dr. Taiba Jibril Afa, the time is up for you to also give us your take on tackling dysbiosis and its related consequences in children. Thank you.
Can you see my slides? Yes.
Yes, I can see.
Good afternoon, everyone. My name is Taiba, not Taiba, as in the Inzimas will say. Okay. So I am a pediatrician, as he said, first and foremost, before I became a gastroenterologist. So I work with small children, and Adjoa has touched a lot on these as well. So this is the outline of my presentation. I'll talk briefly about the history of probiotics, and then what makes probiotics or organism to become a probiotic, mechanism of actions, uses, and benefits of Saccharomyces boulardii in children, its safety and side effects, and then I'll conclude. So I'm starting with a question. Are we part of the problems? When you have, as all of us are either healthcare professionals in its entirety, or we are parents, or we are uncles, we are friends, we know that children almost always, with any little thing, they will develop fever. And me inclusive, the first thing usually people would do would give baby paracetamol. If it doesn't work for a couple of days, they'll give antibiotics. And then if a child has cough and cold, all of us know that the first culprit is virus. And we know that viruses are not managed with antibiotics. But then us will give the antibiotics because we feel that it is long overdue. This has been going on for over 72 hours. A child having an abdominal pain will visit a pediatrician. The first thing they will tell them is you have gastritis. My dear pediatricians online, abdominal pain is never equivalent to gastritis, and the management of gastritis is not with antibiotics. Again, antibiotics are given sometimes in combination with triple therapy, inadequate doses, inadequate duration, and then Nexium or PPI is given the same, and then they would actually also continue with the antibiotic problems. Sometimes malaria, uncomplicated one, is diagnosed, antimalarial is given, we don't even wait to see the response of therapy, and then we would give antibiotics. So what are we doing to ourselves? And even before I even start my presentation, we all know that we are actually killing the good bacteria in our body. That is one. And the other thing also is that the side effect of every medication includes vomiting and diarrhea. And sometimes patients with chronic diarrhea come to my clinic. You take a very good history and you realize that this child had been given gazillion doses of antibiotics. So I believe myself, Dr. Adua J, and others, we are part of this problem. So she had defined microbiota. It is actually the entire population of microorganisms in any particular place. And place here we are interested of the GI system. And then when you say microbiome, we are actually talking about the genome or the genetic material of these organisms. Sometimes, just like you saw in Adua's presentation, these terminologies are used interchangeably. And we already know that there are trillions of these organisms in us. Most of them are bacteria. Just less than 0.1% of these organisms actually belong to the family of the fungi. And microbiota, they are not pathogenic. They live with their hosts in harmony, in peace. They provide them with food. Host body provides them with shelter, and they also protect us, just like we have. In fact, now you know more than I do about the protection the microbiota gives to an individual. Again, what is a probiotic? A probiotic is actually any formulation that it contains living microorganisms in adequate number, and once it is given to an individual, it exerts beneficial effects in that individual. And dysbiosis has beautifully been explained. Once you disturb the microbiota, you are likely going to have dysbiosis, where the good bacteria number just goes down, and then the pathogenic bacteria that are pro-inflammatory, causing all sorts of problems, will come up. What are some of the causes of dysbiosis? Number one is antibiotics and antibiotics and antibiotics. Unfortunately, sometimes the processed food we even eat even contains antibiotics. So inadvertently, you may not have taken antibiotics for the past 3 months, but then your diet could have actually been the cause of the dysbiosis. Life stresses. Children will never get divorced, but then there may be the death of a granny who is very close to a child, a father has developed a stroke, or parents, some dysfunctionality in the family can actually lead to dysbiosis. Not only, and sometimes actually is a combination of most of these things. Once you have the stresses coming in, diet is inadequate, and then you are likely to fall sick as a result of dysbiosis. So the history of probiotic, even before the time of Jesus Christ, Abraham, we know that Prophet Abraham lived a very long life, and it has actually been attributed for him consuming sour milk. Then in 76 Anno Domini, in the year of Jesus Christ, and the Roman Empire, there is an elder called Pliny, and this gentleman used fermented milk in treating diarrhea. Then in 1907, it was observed that taking milk that has lactic acid bacteria or lactobacillus in it actually prolongs life. This is very easy to understand because during that time, there were no antibiotics. As a result, diarrhea and vomiting, dehydration, electrolyte imbalance is going to cause death. So those who are able to take this actually are not dying. And then by 1960, the term probiotic emerged. Pro meaning it's a favor, and bios is a favor of life. So that is the meaning of what probiotic is. Then with Saccharomyces boulardii, there was this French scientist. His name is Henry Bullard, who actually traveled to the Far East in an area known as Indochina. So Indochina is actually made up of five countries: Myanmar, Laos, Thailand, Cambodia, and Vietnam. So around these Indochina countries, there is this river that connects these countries from north to south. As a result, there is the trade, they have the cultural and then economic activities amongst the lot. So this French microbiologist traveled to this region to find new strains of yeast that can be used for fermentation. So during the period he was there was a cholera outbreak. And during the cholera outbreak, it was noticed that some people never got infected with this episode of severe diarrhea. As a result, those who never got infected were actually taking specialized tea that has been made from these fruits, lychee and mangosteen. So these fruits, they would take the peel of the fruits, process it, cook it, and then they would drink it as tea. And as a result, they don't even know, sometimes even in our local areas, we say that people take these things as a form of prophylaxis. So I think that they were taking the tea not only for it being tea, but then as a form of preventing them from whatever. And that is where the discovery came from. So this gentleman set up an epidemiologic study, and he actually was able to isolate the reason why they were not getting cholera amongst those who drank the tea. He was able to isolate the special strain of the yeast. He realized that it belongs to the family of Saccharomyces. And this Saccharomyces, it is able to inhabit the human body, grow in normal temperature around 37 degrees, and then it flourishes. So as a result, the probiotic Saccharomyces boulardii came into being, because as you can see, the surname of the microbiologist is Bullard, and he was named after it. Then in 1947, he sold the patent to Laboratories Biocodex, who developed the research for it and protocols for the yeast called Saccharomyces boulardii. So for a microorganism to qualify to be called a probiotic, or to be to come out as probiotic, has to go through this 9 characteristics. First of all, it should be able to inhabit the human body and should actually exist with the human in a symbiotic state, such that it doesn't cause any problem. It benefits the human as well as the human benefiting from it. During process medication, there shouldn't be any destruction to its cell wall, or anything like that. It should remain intact. Once this organism is taken per os, it should be able to withstand the gastric acid, get into the small bowel, navigate through the biliary bile, and then also it should be able to attach itself to the cell lining of the intestine and then multiply as a result. Once it should also be colonized, at least for even a short period. So even if you are able to go all 3, the probiotic or the microorganism is able to go all the 5 stages, and as a result, it cannot even stay in the intestine, even for a short period, it doesn't qualify. And it should also be able to produce microbial substances such that it would be able to fight pathogenic organisms. And also, it should also be able to improve or modulate the immune response by improving the gut immunoglobulin A, and also influences metabolism. All of these are actually things that are done by the gut microbiota. So once an organism is able to go through all of these stages, then it qualifies to be a probiotic. So the mechanism of action of the Saccharomyces boulardii as a probiotic is basically actually what I have even just explained. It should be it's able to attach itself to the intestinal lining and then competitively eliminate pathogenic organism. And also it's able, Saccharomyces boulardii in its own right is able to destroy toxins, like the toxins produced by Clostridium difficile, toxin A and B are destroyed. That is why it is being used for antibiotic associated diarrhea. And also it's able to stimulate the immune system to produce immunoglobulin A. And for the trophic effect, in patients or animals who have been exposed to, who have had diarrhea, their gut system definitely is not normal. If Saccharomyces boulardii is introduced, what it does is that it actually improves the number or the population of the gut microbiome. However, in patients who are normal or who have healthy or well microbiota, this effect doesn't work for obvious reasons, because their microbiota is actually in a balance. And then in children, the uses of Saccharomyces boulardii are numerous. The first one is actually in acute diarrhea. You know that in children, diarrhea is one of the problems. Whatever kind of problem children have, there is associated diarrhea, regardless of the underlying cause. So it is not just rotavirus, because currently we have a vaccine for rotavirus. So rotavirus in Ghana, for example, is not our problem, but we still keep seeing children who have diarrhea. But this study showed that children between the ages of 3 months to 5 years who have developed acute diarrhea, who were given S. boulardii, significantly had shorter duration of the diarrhea. And they didn't also record any adverse side effects in relation to taking Saccharomyces boulardii. This is in tandem with the regular baseline management of acute diarrhea, which is oral rehydration therapy and zinc. So it is not actually used singularly. Again, the safety and efficacy of this drug has also been tested in a systematic review of 10 manuscripts that involve 1,282 children who have acute gastroenteritis. And in these children, again, it was shown that S. boulardii shortened the duration of diarrhea as well as the duration of hospital stay. And again, there was no adverse reaction observed in these children, neither in the children who were not given Saccharomyces boulardii. In dysentery, dysentery is caused by Entamoeba histolytica and then Shigella. But this study was done in patients who have been diagnosed with Entamoeba histolytica. And there were 50 children who were hospitalized, who were recruited as part of the study. They should have been in hospital for about 3 days, and they were grouped into two. We all know that the baseline for management of dysentery or bloody diarrhea is metronidazole. So they were given two groups, one with metronidazole and S. boulardii, and the second one is just metronidazole alone. And it was shown that those who were given the combo of S. boulardii and metronidazole had shorter duration of diarrhea, and then tests also showed that they eradicated the organism faster compared to the controlled group. And persistent diarrhea. Persistent diarrhea, by WHO definition, is diarrhea that has been going on for at least 14 days or longer. Usually, it may be an acute diarrhea. And then Dr. Afa and her cohorts or her friends would give antibiotics. And then these antibiotics actually will drive the diarrhea, something that would have hitherto lasted for just 4 or 3 days. And by you intervening, iatrogenically causing persistent diarrhea. Once children have persistent diarrhea, there is the risk of malnutrition. Nothing stays in the gut. Remember, children, one thing that helps us is just to grow, and you need food to grow. There is no food. What when that happens? This child will become wasted, will become stunted, will become underweight. Not only that, these children also would have poor immune system, and they are at risk of extraintestinal infection. So for the persistent diarrhea, there was this randomized controlled trial that was taken into children, and 89 children who are between 6 months and 2 years. And these children were grouped into 3. There was the group that was given just milk and lactobacillus. Remember, you have been told that lactobacillus is another type of probiotic or micro or good bacteria. And then there's another group that was given the milk plus S. boulardii. And then there's the third group that was given just the milk and placebo. So these were given to them twice daily for 5 days. And the results shows that the children who were given, the two groups of children who were given the milk together with the probiotics significantly have reduced number of stools per day, and then the duration of the diarrhea. Again, antibiotic-associated diarrhea. Dr. Adjoe Jane Cancer spoke about it. So what does it do? Once the antibiotics is given, it will go and kill your gut microbiota, and then will develop dysbiosis. Once your gut microbiota is killed, there will be not enough number of organisms in the colon to actually metabolize the carbohydrate that comes there into short-chain fatty acids, which would hitherto nourish the mucosa so that the intestine is able to do whatever it has to do. Once the organisms are not there, they are not able to utilize these solutes. It then causes like osmotic diarrhea, and then the diarrhea will just flow. On the other hand, the microorganisms actually are used for the enterohepatic circulation of bile acids. So if these organisms are killed by bacteria, then the bile acid will traverse from the terminal ileum into the large bowel, and then it will cause secretory diarrhea, and then you'll have antibiotic-associated diarrhea. But then use of Saccharomyces boulardii, as we showed up in the mechanism of action, would actually do what? Would promote the number and diversity of the gut microbiota, and would end the problems of antibiotic-associated diarrhea. Again, Helicobacter pylori is an organism that usually would inhabit or infect humans right from childhood. Most of the times in children, it is asymptomatic as compared to adults. But then in some children, it presents as symptoms with so many as well as abdominal pain. So in this study, 90 children who are symptomatic and have been diagnosed endoscopically using the standard guidelines for diagnosis of H. pylori were also grouped into 2. One arm was given the standard triple therapy with S. boulardii, and the other arm was given just the standard therapy, and then they were monitored. At the end of the duration of 2 weeks, these children were brought back into the hospital and they did the intervention again. However, I must say that diagnosing the eradication of H. pylori, you don't need to do endoscopy to be able to say you do the stool H. pylori test. But this study used the rapid urease test as well as histology to confirm the eradication of H. pylori. And the result shows that 93% of children who were given S. boulardii and the standard treatment therapy were able to eradicate H. pylori compared to 80.9% of children who had just the standard therapy. And again, the incidence, antibiotics, they are given a couple of antibiotics, PPI, there are some children who develop side effects. Again, in these children, those who were given the standard therapy together with the S. boulardii, 30.1% outperformed as compared to 8.3% of children who had just the standard therapy. And then in a randomized control trials, 15 studies were taken, and the meta-analysis was done to see the effects of S. boulardii in children who have been infected with H. pylori. And it was also shown that those who have H. pylori, Saccharomyces boulardii supplementation have significantly lower incidence of adverse reaction compared to those who had the standard treatment alone. This probiotic also has something good in premature babies. So again, some premature babies between the gestational age of 30 weeks to less than 37 completed weeks were recruited into the studies. And the intervention given to them was 50 milligram per kilogram of S. boulardii morning and evening. And then their weight was monitored, their progress of feeding was monitored, and then up to when they would be able to catch up full oral or enteral feeds was also monitored. And it was shown that their weight, actually they gained weight faster, and then they were able to reach the maximal food required per their weight also was obtained faster compared to children who were not given S. boulardii. Functional abdominal pain is one of the major problems that comes to a gastroenterologist clinic. And when we say functional abdominal pain, it is an abdominal pain that has been present for at least 2 months, and you would have done investigations would have been done in terms of the blood, urine, imaging studies, checking for cancer, everything, and there would actually you are not able to use any of these investigations to say that this is the cause of the abdominal pain. However, there is the pain. It's actually a diagnosis that we see a lot in children. So again, a total of 104 children who have functional abdominal pain were enrolled in this study. They were randomly selected. 52 of them were given S. boulardii as a form of management. And then the other group was given just placebo, and for a total of 3 weeks. And their pain severity was monitored and evaluated to see. So it was noticed that the children who were given S. boulardii had more effective response in terms of their pain threshold compared to children who were given just the placebo. Also, what this study also noticed is that the abdominal pain that is associated with other problems, also in relation to those who had been given S. boulardii, the vomiting, the constipation, discomfort, epigastric, poor appetite, everything also reduced in tandem with the abdominal pain that it came across. Like everything else, there is the safety. Once there is a good side, there is also the weakness. So generally, this yeast is very safe and is well tolerated in humans. And the commonest adverse effects would include bloating and flatulence. And then also, there had been reported cases of infections and fungemia in 1 in 5.6 million of children. So you need to know, although they are good bacteria, they are yeast microbiome, they are non-pathogenic. In certain circumstances, they can actually cause problems. So in those circumstances, you don't give probiotics to such children. So in children who are critically ill, example in the ICU, regardless of whatever their GI system is doing, giving probiotic is usually not recommended. And patients who have immunodeficiency, once their immune system is down, you don't usually would have to give probiotic, because just like we see in normal life, soldiers who are supposed to protect us can decide to do coup d'etat. And once you have a weak immune system, things like this could happen. So as a result, you don't give probiotic or any Saccharomyces boulardii to such groups of children. And also those who have central lines and indwelling catheter, you also do not give them probiotics. So in conclusion, Saccharomyces boulardii is generally safe. It is effective even in newborn children. It's used in the management of so many problems, including diarrhea, and then it is effective in eradicating H. pylori in tandem with the standard therapy or triple therapy, not as a standalone therapy. And then in preterm also, it improves their growth. It improves the time for them to get full feeds, which is a hooray moment for the parents. And then for functional abdominal pain, which is a big problem for some of us in our clinic, is a drug that would help in the management of functional abdominal pain. These are my references. Thank you all for listening.
Thank you very much, Dr. Teiba. I hope I got it correct this time. Brill Afa, like I said, one of the only 2 pediatric gastros that we have in the country. And Dr. Teiba took us, he gave us some history lessons, telling us about how Boulardii went to Indochina and discovered that the tea that they were drinking, which had mangosteen and lychee, was or contained S. boulardii, and that gave them certain benefit as against those who didn't. Dr. Teiba also talked about the importance of S. boulardii in children, and even to the extent of preterm babies, which I found very, very, very interesting. And to end it all, he also talked about the fact that although it is recommended for use in children, under certain conditions like children who are critically ill, people or children who are immunocompromised, children who have indwelling central venous catheters, S. boulardii should not be used for such children. So that was a very, very good and insightful presentation from Doc. We are very, very grateful. Just like I said, you can keep dropping your questions at the chat column, and at the end of it all, we will attend to all questions. And I know that, yes, there are a lot of things to learn also from the question and answer time. So now we move on to the last presentation that is supposed to be done by my colleague here, Farm Dr. Ni Abeseko Ashon. And what is he going to talk about? By now, I know that, yes, the foundation for S. boulardii as an effective component in the management of dysbiosis has already been established. But the question that needs to be answered is, which S. boulardii are you giving? And why should you choose one S. boulardii over the other? Is one having certain characteristics and certain features that provides unique advantages and benefit for your patient than the others? And to do that, as I've already introduced, Farm Dr. Ni Abeseko Ashon will do justice to that. So Ni, it's your time, let it flow.
Okay, so I bring you greetings from Mega Life Sciences Ghana Limited. As I've been introduced, my name is Nee. I'm the product manager and superintendent pharmacist. And together with our colleagues, we give you wonderful felicitations from Mega Life Sciences. Mega Life Sciences is a pharmaceutical company. We originate from Australia and Thailand, and we are well known for producing high quality, cost-effective medications in every jurisdiction that we find ourselves. And Mega, we always say what we care. When we say we care, it means we care a lot about human wellness. That translates into the kind of relationship we have with key opinion leaders like yourselves. But more importantly, that also drives us and makes us very passionate about doing research to come up with tailor-made medications that do not only relieve symptoms, but significantly improve the quality of life of disease sufferers significantly. We are also well known for our good manufacturing credentials in every jurisdiction that we find ourselves, including Ghana, where we've been operating for the last 15 years, marketing high cost-effective quality medications. Okay, but today we have very good news for your patients that come with dysbiosis and its related complications like diarrhea in children and also in adults. And through that, we introduce our unique probiotic that we have introduced into the Ghanaian pharma marketing space called Normagut. So as part of our presentation, we'll do a brief summary of the implications and causes of dysbiosis, especially in the health of children and ultimately adults. We'll also spend a few minutes to talk about the role of Saccharomyces boulardii in dysbiosis management. And then through that, we'll introduce a unique innovation in the probiotic space called Normagut and talk about its unique features and benefits and how it will help to correct dysbiosis and also its related complications or symptoms like diarrhea. As we've been made aware, or as you're already aware, the gut is inhabited by several millions and even trillions of microorganisms, and together they form what we call the gut microbiota that has significant physiological benefits for the host or for human health, including metabolism of dietary carbohydrates, even in digestion, aiding in digestion, also helping boost the immune system, and also help protect against disease pathogens. Okay. There's also the so-called gut microbial axis, where when there's a problem with the gut microbiota, it will have implications on CNS health, including depression, anxiety, autism, multiple sclerosis, and even metabolic disorders like what non-alcoholic fatty liver disease, obesity, etc., and etc. Then again, one would ask, what then is dysbiosis and what are the implications of diarrhea that makes it very dark that we need to have this very important conversation about it in this very particular time? Like we've already been told, or like we already are aware, when there's an imbalance in the gut microbiota, where the harmful bacteria become more than the beneficial biota, the beneficial organisms, this that we refer to as the dysbiosis, or what we refer to as gut microbial dysbiosis, with its related consequences, including an increase in gut permeability that also increases the risk of endotoxemia and septicemia. This is because the gut flora or the gut microbiota or even the gut is made up of what we refer to as atypical junctions. And these atypical junctions prevent the systemic invasion of the blood with regards to pathogens. So what happens is that when there's increased gut permeability, then pathogens or disease pathogens are able to get access to systemic circulation, leading to endotoxemia or even septicemia. When there's dysbiosis, there's also an increased risk of systematic or systemic inflammation. There's also an increase in insulin resistance with this related consequences like diabetes. Then also there's issues with non-alcoholic fatty liver disease, non-alcoholic steatohepatitis, irritable bowel disease, and also inflammatory bowel disorders. You see, our main concern is actually the risk factors or causes of gut microbial dysbiosis. You really look at the risk factor, you realize that these are risk factors that seem to be on the ascendancy. First, there is the issue of high sugar diet. I'm sure for all of us who have children, you realize that for children that are in the Montessori system, it's as though now getting sugary drinks to school has become a mainstay. And we all know that these sugary drinks, once the children become addicted to it, something that they will take on a daily basis, on a regular basis, and this will increase the risk of dysbiosis. Then there's the issue of high-fat diets. Then again, I mean, when we're growing up, the issue of, I mean, our day and all that, our parents, I mean, would want to cook for us, and then we'll go to school in our cute baskets and napkins and all that. But nowadays, during our days, children will want to take the KFCs, etc., that have high amounts of trans fats, which are quite dangerous, especially to gut health. Then there's the issue of sedentary lifestyle and overnutrition. I mean, we have children nowadays who are now stuck on their tablet because, unfortunately, sometimes we, the parents, do not have enough time to monitor them when they are outside and running about, or we are scared that they will get hurt. But this actually encourages sedentary lifestyle, increases the risk of child obesity or childhood obesity, which could increase the risk of gut microbial dysbiosis. Then there's the issue of antibiotic abuse, which is quite rife in our system because we are now even battling with antibiotic resistance and all that. And even in managing conditions like diarrhea, sometimes people end up giving antibiotics, which may make the dysbiosis worse. Another main consequence of dysbiosis is diarrhea in an acute phase, especially in children, and consequently also in adults. Because you see, when there's dysbiosis, there's also the disruption of the protective mucous layer. There's also maybe an accumulation of undigested carbohydrate. This is because you see, in conditions like viral diarrhea, there's a decrease in disaccharide levels that affects carbohydrate metabolism. And this is actually what leads to accumulation of fluids in the gut through osmosis. And this is what leads to osmotic diarrhea. So consequences of dysbiosis is myriad. Together with the increased gut permeability, increased systemic inflammation, and increase in metabolic disorders like insulin sensitivity and non-alcoholic fatty liver disease. There's also the issue of diarrhea, which may happen in different forms of dysbiosis. And that's the reason why Mega Life Sciences is very proud to introduce Normagut capsules that do not just stop diarrhea, but goes a step further to normalize gut flora in children and then also in adults. Who are we indicating Normagut for? We are indicating Normagut for those with antibiotic-associated diarrhea, or for those who want to prevent antibiotic-associated diarrhea, for those with Clostridium difficile infections, for those with acute and persistent diarrhea, those who are on enteric nutrition that is leading to diarrhea, those with traveler's diarrhea, and even those with H. pylori eradication therapy induced diarrhea. Okay. For those with inflammatory bowel disorders like Crohn's disease, ulcerative colitis, irritable bowel syndrome, Normagut is highly indicated to be very beneficial in such patients. And for those with HIV-related diarrhea also, you find Normagut to be very useful. What Normagut does is not just stop diarrhea, but also protect against disease pathogens. What Normagut also does is to restore digestive health by restoring the normal gut flora. They're also able to protect against allergies and normalize, more importantly, stool consistency and then stool frequency. Okay? The uniqueness of Normagut lies in its mechanism of action with regards to correcting dysbiosis and managing diarrhea of different etiologies. You see, like I said earlier, when there's dysbiosis, the disease pathogens become more, or the bad bacteria become more than the good bacteria. And these bad bacteria, they'll produce toxins. And Normagut has three main mechanisms of actions. It has what we call the luminal action, the trophic action, and then the mucosal action. So with regards to the luminal action, when the disease pathogens produce these toxins, Normagut produces three main enzymes that counteract the effect of these toxins. Main pathogens that it counteracts are what we call the Clostridium difficile toxins A and B, cholera toxin, and then also the E. coli toxin. So you realize that Normagut is able to counteract these toxins by producing three specific enzymes. Also realize that the bad bacteria also cause a loosening of the tight junctions by destroying it and invading systemic circulation. What Normagut does as part of its luminal action is to have antimicrobial activity by preserving the tight junctions and preventing the invasion of systemic circulation by these pathogens. What it also does is to cause the disease pathogens to adhere to its surfaces. Okay, so once it adheres to its surfaces, it prevents the bacteria from invading systemic circulation. And this is part of its antimicrobial activity that falls under its luminal action. Then, usually, when it comes to antibiotic abuse, the antibiotic actually destroys the intestinal flora. What Normagut does is to restore the gut flora by producing an energy substrate through an increase in short-chain fatty acids that favors normal colonic function or the regeneration of the gut microbiota. When it comes to viral diarrhea, what the virus does is to reduce the disaccharide levels, and this actually leads to an accumulation of carbohydrate, leading to an increased rate of osmotic diarrhea. What Normagut does as part of its trophic action is to increase the concentrations of the disaccharidases in the gut, and this actually aids the digestion of carbohydrates and reducing the risk of osmotic diarrhea. Then again, as part of the trophic action of Normagut, it actually increases the immunoglobulin A, that increases immune defense in the gut, because you see, when there's dysbiosis, there's also a decrease in immunoglobulin A. Then lastly, as part of its mucosal action, it has what we call anti-inflammatory benefits. This is because, in conditions like irritable bowel syndrome and inflammatory bowel disease, there's a chronic inflammation of the gut, as you could see, with its consequences like diarrhea because of the inflammation. And what Normagut is able to do is to act on cellular signals and decrease synthesis of inflammatory cytokines like interleukin-6. Okay. The uniqueness of Normagut actually comes with regards to a unique German technology we adapted called the freeze-dry technology that actually increases the stability, the viability, and efficacy, and also ensures a rapid solubility of Normagut. And this is the reason why Normagut comes in an innovative capsule form, because we realize that in our settings, there's high humidity, and therefore, if it is not in an innovative capsule form because of the freeze-dry technology, these yeast-based spores will easily coalesce and it will affect the solubility and make it very difficult to actually administer to children, especially if you have to just tweet and then mix in their feed or in their express milk or in their nutrition. So with the innovative capsule technology, preserve the stability, makes it very easy to administer to children and also easy to carry. Another very important benefit of Normagut is the fact that it is non-pathogenic and it's antibiotic resistant, and therefore it has been clinically proven to be very effective in managing diarrhea of different etiologies. What makes Normagut very different from your typical bacteria-based probiotics is the fact that because it is a yeast-based probiotic, it is antibiotic resistant. More importantly, the size of the yeast spores in Normagut is 10 times bigger than the bacterial spores. So through a phenomenon referred to as steric hindrance, it's able to compete much more effectively with the disease pathogens with regards to competing for space, for nutrition, and then receptor sites as compared to a bacteria-based probiotic. So this is what makes Normagut stand out as a yeast-based probiotic as compared to the typical bacteria-based probiotics. Where that's the dosage of Normagut in children. Okay, in preventing antibiotic-associated diarrhea for children who are over 2 months to 2 years, it is 1 capsule daily during the entire duration of the antibiotic therapy, then an extra week after the antibiotic therapy. All you have to do is, because of the unique German freeze-dry technology and an innovative capsule form, all you have to do is to just twist the capsule, as you can see the woman doing here, pour in their milk or their expressed milk, and then let the children enjoy. It doesn't have any bitter aftertaste. It doesn't have any bitter taste. So the children, is very, very easy for them to comply to this. When you are using it to treat acute diarrhea for children over 2 months to 2 years, it's 1 capsule daily for 5 to 6 days. Very convenient. For those with persistent diarrhea who are 2 years to 12 months, it's 1 capsule BD for 1 to 4 weeks. For those who are over 2 months to 2 years, it's 1 capsule daily for 1 to 4 weeks. With adults, the dosage is 1 capsule BD. I mean, for all the indications we've already spoken about, it's just a BD dose. Very easy to comply to this. S. Buladi is the most extensively studied yeast-based probiotic in the world. So there's been a lot of clinical trials that has been done with regards to the benefits of S. boulardii in correcting dysbiosis and its related consequences like diarrhea. In this particular clinical trial, S. boulardii was found to significantly reduce antibiotic-associated diarrhea as compared to placebo. So you realize that the percentage that developed antibiotic-associated diarrhea in the S. boulardii group was significantly lower than those who were placebo. Then S. boulardii has also been shown to significantly improve H. pylori eradication therapy associated diarrhea and also improve GI discomfort, much better than placebo. And you will see from here, from the graph, H. pylori eradication therapy rate was much higher in the S. boulardii group than in placebo. Then when it comes to epigastric discomfort, you realize that the epigastric discomfort was much lower in the S. boulardii group than placebo. Research has also suggested that S. boulardii improves significantly the quality of life of patients with irritable bowel syndrome, much better than placebo. As you can see from the graph here, S. boulardii quality of life score much higher than in placebo. S. boulardii has also been shown to reduce mean number of stools in children with acute diarrhea as compared to placebo, as you can see from the graph here. And even here also, you can see that in day 2 and day 3, the frequency of diarrhea in children was much lower than placebo. There's also another clinical trial that speaks about the combination of standard antibiotics together with S. boulardii being much more effective and safe in those with recurrent Clostridium difficile disease as compared to placebo. You can see from here, recurrence rate in those with recurrent Clostridium difficile disease is much lower in the S. boulardii arm than in placebo. And also the recurrence rate in those with initial Clostridium difficile disease is much lower in the S. boulardii group than as compared to placebo. And last but not the least, there's also another clinical trial that shows that S. boulardii, when used in combination with vancomycin, reduces the recurrence of Clostridium difficile disease as compared to placebo. So you can see from here, the percentage of recurrence from CDD is much lower in the S. boulardii arm than in the placebo arm. And lastly, it's been shown that S. boulardii was able to improve weight gain and reduce HIV-associated diarrhea than in the placebo arm. You can see from here, percentage reduction in diarrhea is much higher in the S. boulardii group than placebo. Okay. When it comes to the pharmacokinetics of S. boulardii, it's very favorable. You will see from here that S. boulardii is able to survive in the gastric acid and then in the bowel, and is detected alive throughout the digestive system if given daily in the freeze-dried innovative form as comes in Normagut. Okay, it's also resistant to antibiotic therapy, so it can be used concurrently with the antibiotic therapy to protect the integrity of the gut microbiota. Regards to drug-drug related interactions, S. boulardii can be used effectively with antibiotics to reduce the frequency and duration of diarrhea. It can also be used as an antidiarrheal agent. When it comes to the use of S. boulardii with antifungals, it's been shown that the S. boulardii efficacy may be reduced in the presence of antifungals. So kindly take note of this information. And then when it comes to inflammatory bowel diseases where we have to use methalazine, when you combine methalazine with S. boulardii, it's been shown to be more effective than methalazine alone for reducing diarrhea that comes with chronic diseases. Okay. I mean, there's been no adverse reactions reported in any of the clinical trials that have been done with S. boulardii. Few side effects that are worth mentioning is Saccharomyces boulardii-induced fungemia, especially for patients who are severely immunocompromised and who are hospitalized, and for patients who have indwelling vascular catheters. I mean, those are the key parts that you have to take note of and exhibit caution. No adverse drug reactions reported in clinical trials. This have already been confirmed in the previous study. And it's for this reason that Mega Life Sciences is very proud to introduce to you the innovative freeze-dried form of Saccharomyces boulardii as found in Normagut that not just stop diarrhea, but also normalize gut flora. So in summary, what Normagut is able to do is to shorten the duration of diarrhea and also go beyond that to preserve the normal flora, normalize both stool consistency and then stool consistency, with its associated increase in social and economic benefits for the patients. Okay, like I said, in summary, because of the freeze-dry technology we are using and then the new innovative capsule form, there's much better stability, better viability, better efficacy, and more rapid solubility when used in children and in adults. Thank you so much for your time. We are so grateful. If you have any questions, we are more than willing to take this. Thank you.
So thank you very much, Ni, for that great presentation on Normagut that normalizes your gut. So ladies and gentlemen, distinguished ladies and gentlemen, and valued healthcare partners in healthcare, you've just listened to a presentation on Normagut, Mega's own probiotic that contains S. boulardii. And as usual, I'll just give you a brief or a summary of what I picked up from Ni's presentation. So Ni, per his presentation, made known of the fact that Normagut stops diarrhea. It also restores the normal gut flora and normalizes stool consistency and frequency. And Ni made us aware that Normagut exhibit three main functions. It has the luminal function, the trophic function, and the mucosal function. And all these put together, what it will do is that it will counteract effect of toxins emanating from Clostridium difficile, E. coli, and cholera. It will also prevent adherence to, it ensures adherence to the surface, that is the luminal function, so that it prevents the microbes from invading systemic circulation. Yeah, it also enhances the immunoglobulin A, thereby enhancing the immuno protection ability of the body. And what makes Normagut so unique on the market? He made mention of the fact that, yes, it's freeze-dried, and the technology of freeze-dried is to ensure three things. Number one, the stability of the molecule. Number two, the viability of the molecule. And the third thing is that the rapid solubility of the molecule. And because of its be it a yeast base, it is non-pathogenic, antibiotic resistant. Yeah, and he talked about the fact that in antibiotic-associated diarrhea, in combination with triple therapy for H. pylori, as well as H. pylori antibiotic-associated diarrhea, in IBS and acute diarrhea, Normagut can be used. So, ladies and gentlemen, that was a summary of what my colleague Nee talked about. Now is the time for us to come in with your questions. So if you have questions, like I said, you can still post your questions in the chat, and then we would answer all your questions. So for my panel members or my faculty members for today, there are a few questions that have come in. So we'll do the first batch of questions. So Dr. Ajueje, someone wants to find out that you talked so much about the gut biome. So there are two questions on that. The first question is that, does sleep in any way affect the gut biome? The question is, does little or no sleep affect the gut biome? And number two, the person also wants to know, do we have anything like having too much probiotic in your system? So these are the first two questions I will put to you, Dr. Ajueje, from our audience.
Thank you very much. I'll start with the second one. With regards to the too much gut biome, once you have too much of it, then meaning that there will be dysbiosis, unless, of course, it's balanced. So the important thing is having adequate amount and then having it in a balanced way. Now, in terms of sleep, research has shown that when you go to the sleep platform, a healthy microbiome can lead to a more and a better sleep. So basically, it's like looking at the anxiety, the gut-brain axis, and once everything is fine, then you can have a good sleep. So a healthy gut will help with a good sleep. Thank you.
Oh, okay, thank you very much. So from Dr. Adjoeje, he says that a healthy gut is essential for a good sleep, and too much probiotics can also lead to dysbiosis. I think that are the takeaway from him. Okay, so Dr. Taiba, there's a question here, and I think this question goes to you, since you talked a lot about the use of probiotics in managing diarrhea. A question here is that, so are we advocating that for the management of diarrhea, especially in children, we shouldn't use antibiotics, but rather resort to probiotics? That is a question one respondent or one person on the call want to find out from you, Dr. Taiba.
Thank you very much for the question. If this individual had listened carefully, at a point I said that the management of diarrhea is in tandem with WHO recommended therapy. That is the ORS and zinc. So yes, ORS and zinc are the cornerstones of the management of diarrhea. However, antibiotics is not recommended for the management of diarrhea unless it is bloody diarrhea or dysentery. That is where you would need to use metronidazole as therapy together with ORS and zinc. Remember, if you have a child who has diarrhea, the child is losing fluid and is losing electrolyte. An electrolyte imbalance is enough to cause acute kidney injury. We have had children who have come into hospital just because of diarrhea that has not been managed with oral rehydration therapy. Antibiotics is not a standard treatment for diarrhea. ORS and zinc is the first line of treatment. However, if you add probiotic, if you add S-Buladi, then the duration is going to increase as evidenced by the manuscripts I have shared with you. And then if it is hospital, duration is also going to be reduced. Thank you.
Okay. Okay. I think it's a network issue.
Yeah, I think it's a network issue.
Okay. So there's also another question. Dr. Adjoeje, someone wants to find out, how does butyrate actually affect the obesity and other conditions? So he's asking, how does butyrate affect obesity and other conditions? And there's another question, Doc. Before that, I think I can add one more question. The person wants to find out what is the effect of probiotic, or people who are lactose intolerant. Can probiotic be given for such people? He wants to know what's the relationship between probiotics and lactose intolerant patients.
She's talking. She's talking, but okay, you try rejoining again, and then, if possible, ask from your side. Let me call him too.
I'm sorry. So with the butyrate, as I already said, the microflora are able to, the gut biome are able to produce butyrate, they are able to produce acetate and propionate. What happens is that butyrate, the organisms that secrete butyrate are able to metabolize complex polysaccharides, like even the cellulose, the hemicellulose, the mucins, etc., that normally our digestive system are not able to do that. They are able to do it. And so they produce lots of energy in their colon that will be utilized by the body. So the body is taking in adequate amount, and excess production that's being done because of the butyrate. So that's one way they cause the obesity. However, if there is a balance, then with the firmicutes, which is able to downgrade it, then it's able to keep it in check. So it's a dysbiosis that will cause that, with the organisms producing butyrate in higher levels. And then the second question was lactose intolerance. There are different types, okay? So usually there's one that one is born with, and the probiotics may not help you. But sometimes people get it as a result of chronic diarrhea, especially when we take patients who have like immunosuppression, like HIV positive patients, who have cryptosporidiosis, who have Giardia lambda, causing all these diarrheal diseases. It leads to sometimes atrophy of the villus, and that leads to malabsorption. And sometimes, because of the chronic diarrhea, it distorts the microbiome. And therefore, for some of them, if their immune systems are fine, then we can introduce probiotics. But as has already been alluded to, if there's severe immunosuppression, then these organisms or these microbiota, which are living things, should not be introduced. Thank you.
Okay, thank you very much, Doc. Okay, someone wanted to find out, okay, to the member who asked what brand of Boladi is on the market. Yes, the brand of Boladi that we talked about is Normagut. Okay, that is what we talked about, Boladi. Okay, then yeah. There is another study here. There is another question here. I think the person wants to know the indications under which Boladi should not be given. That Dr. Teba talks about. So I can quickly run you through. He talks about critically ill patients, immunocompromised patients, and patients who have central venous catheter. Dr. Teba, I think I'm spot on that, isn't it?
Yes, you are.
Okay, so
and very severely sick individuals, you won't give this to them. Okay. Children who are in intensive care, even if they have diarrhea, you usually will not give them Normagut or probiotic. And then if they have severe deficiency, you don't give.
Okay. So someone asked a very interesting question, Dr. Teba. He says that, yes, we say that people who are severely immunocompromised patients, we shouldn't give Boladi. Then he said somewhere along the line, he realized that Boladi can be HIV-associated diarrhea. So how do you reconcile or align the two? That in HIV-associated diarrhea, the perception is that that person is immunocompromised. So how can we give Boladi for that person?
Okay. The good thing is that Ajwa is also a champion for HIV. So if I'm wrong, she will correct. She did HIV for a long time. Yes. Okay. So there is the difference between HIV problem with okay, I can see myself here. Okay. The internet is not stable. Okay. Yeah, so there's the difference between HIV infection and then AIDS. When you have HIV infection, you sort of you are not severely immunocompromised. You can have diarrhea, and then that would actually be managed. Remember, baseline is ORS and zinc, and you can add your probiotic. But if you have AIDS, then you wouldn't want to give a microorganism, because just like I stated, it could blow out in your face or it could cause an infection in that individual. And also, there are so many organisms that cause diarrhea in HIV or in patients with AIDS, like Cryptococcus. Those ones, there is specific management for those ones. And once you also remember that this individual will need the highly active antiretroviral therapy. So it's actually a combination of so many things. And then once the immune system, there is response, you do your CD count, all those things, then you can, and it is normal, you can add your probiotic. Otherwise, if it is severe immunodeficiency, I don't think you would need to give probiotic. Otherwise, it will be counterproductive. Adwa, since you are HIV guru, what do you have to say?
I think I agree with you. And then the probiotic, it also has some immune mediating effects. Okay. So just as she said, they are prone to chronic diarrhea. Okay. And ART we know is the thing we need to keep. So if their CD4s are fine, if they are not in the AIDS category, you can give your probiotic as you treat the patient as well. Thank you.
Okay. So, this question goes to you. Number one, a person wants to find out, should Normagut be taken with food or without food? And two, how easily accessible is Normagut on the market? So I think you can provide details on that. The person wants to find, number one, should Normagut be taken with food or without food? And is Normagut easily available on the market? Me.
Okay, please, am I audible?
Yes, you are.
Okay, great. So yes, Normagut can be taken with meal. Okay, based on the clinical trial that has been done, Normagut, if taken with meal, it's very ideal. Second question about availability. Yes, Normagut is readily available both at the retail space and then also the wholesale space of all reputable pharmacies in the country. We launched it about 2 months ago, and our sales team and medical representatives have done a very good job making sure that they are available in all Class A pharmacies and reputable wholesales also. Yes.
Thank you very much on that. Okay, Dr. Ajuaje, there's a question. This question goes to you. Can probiotics be taken as prophylaxis?
I would say no. Okay, and every medicine you are looking at the risk and the benefits. There's this professor, Harvard Chan School, and what he said was School of Public Health, that you give your probiotics when needed, but to give to a healthy, normal person as prophylaxis should not be done. It's medicine; these are live organisms. And that can actually, so one of the things is that if you don't need it, you don't take it. And there are clear indications for probiotics. Now, with the other organs that we talked about, the obesity, etc., yes, research is moving towards that, but it hasn't been really confirmed. But the pathogenesis has been confirmed that it's associated with it. As to whether replacing these would help is still in the experimental phase. So don't take it prophylactically. Thank you.
Okay. There's another question that goes to someone wants to find out. I think the person said he missed out on the drug-drug interactions that you talked about, Normagut. So can you kindly rehash the drug-drug interactions that you mentioned with Normagut? I remember, for example, you talked about the effect of antifungals on reducing maybe the efficacy of Normagut and talk about the other things. So can you kindly rehash it for the person?
Great. Thank you very much. Like I mentioned, when it comes to the use of Normagut with antibiotics, because it's antibiotic resistant, it could be used concurrently with antibiotics when managing antibiotic associated diarrhea. So it can be used concurrently with antibiotics. I did mention again too that antifungals will reduce the efficacy of Normagut that has S-Buladi. So it should be used with caution when you are recommending it concurrently with an antifungal agent. I did mention also that when you are using mesalazine, like you use it for inflammatory bowel diseases, it could be used concurrently with Normagut because there is much greater efficacy in reducing the inflammation, reducing the recurrence of diarrhea with people with inflammatory bowel disorders like Crohn's disease and ulcerative colitis as compared to using mesalazine alone. Yeah. Then lastly, I did mention also that it will also be used as an anti-diarrheal agent because there's a lot of research that suggests that S-Buladi, as found in Normagut, it will be able to reduce the duration and then the number of stools that happens in diarrhea. The diarrhea frequency also is reduced when S-Buladi is used, as found in Normagut. Yes.
Thank you very much. There's also another interesting question between Dr. Adjoje and Dr. Tabe. I don't know who picked it, who picked this question, but the question is this: that Doctor, I think the last question I asked you was about the use of probiotics as a prophylaxis, in which your answer said no, you won't recommend it. But then this question says that he knows that yogurt is considered as a probiotic. So then, does it mean that he doesn't have to take yogurt frequently since it's a probiotic?
Thank you very much. So there are different types of yogurt. The pink one we buy from farm milk is not the yogurt that is thing. But there are special yogurts that have been produced that has different types of microbiota. And sometimes it's given as prescription. Taking it, like those are the sour kind of yogurts. That's the natural one, that is fine. Remember, some of these yogurts contain prebiotics rather than probiotics. And probiotics are the living organism. But prebiotics are those that have the substrate. Okay, so they are not living organisms. So you can give it to them, and based when they work on them, you get the advantages of that. So there are special yogurts for that, and not everyday farm milk yogurt. Thank you.
So in a nutshell, okay.
Yes.
Dr. Taylor, please go on.
Yes. So I realized Adjoa's facial expression and my expression, my facial were similar. And remember, yogurt is milk. And when you don't need milk, as adults, you don't. So if you take so much milk, as an African person like me, you don't have a lot of lactose. So you become lactose intolerant. You have a lot of diarrhea. So if you don't need it, you don't take it. Taking it once a while is fine. But then taking it regularly, you reap the consequence. So you can try it and then give us the feedback.
Okay, thank you very much. There's this also interesting question here. The person wants to find out that he or no, she has been told, or she is the known that the use of probiotics, it's also very good for fungal infections, especially in women. And he talks about candidiasis and all that. So he just wants to find out that if that is the case, can S-Buladi be used when she's faced with such a condition?
If I may respond, in my literature, I didn't see for mainly the indications were for acute and chronic diarrhea, and like irrespective of the cause, as you treating the cause, it can be supplemented, or in the early stages, it can be used to control it. But as to having let me make some correction. For instance, if you have a well-established infection, you don't say, I'm going to take probiotic to get you biosis. Treat the infection and then restore your dysbiosis. So if you have, say, let's say, vaginal candidiasis, treat it, and then you can take your thing to stabilize the dysbiosis that occurred. Because most of the time, for instance, the misuse of antibiotics can distort your microflora or your microbiome, and that can cause invasive like fungus to take over. That's why it's so common, immunocompromised, etc. So you treat and then you correct the dysbiosis. Thank you.
Let me also behave like an ONG specialist. So when you look at the probiotic we are talking about, it's actually we're talking about working in the gut. But then in adults, it has shown that it does X, Y, Z. However, when you look at the female genital tract, it also has its own microbiota. And that microbiota is actually distorted by cleaning, douching, putting things there. So if you leave it quiet, the microorganisms there, which is mostly acid-based or lactic, I think lactic acid associated, is in harmony. You won't get discharge, you won't get any problem. So my advice is don't put anything there. Leave it alone. It's a self-cleansing organ. Thank you.
If I can add a bit to it also, let's be careful because the gut flora in our birth canal, in the vagina, is what gets established in the first month in the baby. So if you want your baby to have a healthy gut microbiome, then you need to take care of your place by not distorting that. Thank you.
Okay, thank you very much, Doc. This question goes to you. One of the people on the call wants to find out how different is Bacillus cloci from S. boulardii, and why should he choose S. boulardii over Bacillus cloci?
Okay, so that is a good question. I think in one of my slides, I did talk about how yeast-based probiotics like Normagut is different from a bacteria-based probiotic, and I spoke about the spore size of a yeast-based probiotic like Normagut being 10 times bigger than a bacteria-based probiotic. So through a phenomenon referred to as steric hindrance, a yeast-based probiotic like Normagut is able to compete more effectively with the disease pathogens, competing with them for space, for nutrients and receptor sites. So they're able to actually stifle the growth of the pathogens and their activities much better and much more effectively than a bacteria-based probiotic, because that has 10 times less in size. So with regards to occupying space, they are not able to effectively do that as compared to a yeast-based probiotic like Normagut. I also spoke about antibiotic-associated diarrhea and the fact that if you want to use a probiotic, it will be ideal to use a yeast-based probiotic like Normagut, because then that is antibiotic resistant as compared to a bacteria-based probiotic. So those are the key differences among the two, and why you should choose a yeast-based probiotic like Normagut in these conditions. Yes, thank you.
Okay, thank you. So this question is open, so anyone can take it up. I think Dr. Graham A. Dubanaman wants to find out that, yes, in one instance, we talk about probiotics helping to gain weight, and in another instance, we talk about probiotic helping with weight loss. So the issue is, where does probiotic actually tilt towards? Is it tilting towards weight loss or weight gain?
Okay, so if there is eubiosis, then you have, in addition to other genetic factors, etc., then the assumption is you have a normal weight. But when there's dysbiosis, that is where obesity, type 2 diabetes, etc., resurfaces. So what they said was that if you look at the Italian and then the Burkina Faso study they did with regards to children, even the type of food will determine the type of flora you have in terms of your microbiome. And if the bacteroides is in excess in terms of the ratio, then you're at increased risk of developing obesity compared to somebody who has low bacteroides in the gut biome. So it depends on the balance, ideally. So if you have a well-balanced thing, then if all other factors are fine, are positive or advantageous for you, then you wouldn't have a problem. But the dysbiosis is what will cause the obesity. Thank you.
Dr. Teba, do you want to add on, or I shoot you another question?
No, a different question.
Okay.
Okay,
So
Mr. Godfrey.
yeah,
Yeah.
me.
Yeah, so I just want to add to that.
Okay.
There was one slide that we were talking about HIV-associated diarrhea. And we did mention in that particular clinical trial that it's able to help reduce the frequency of stooling in HIV-related diarrhea. And true, that also helps with weight gain. But this is specifically for HIV-associated diarrhea. Please kindly note that just like our esteemed facilitators have mentioned, there is a difference between AIDS and HIV, or we have to look at the loads and all that. So usually for HIV-related diarrhea, where there's a lot of diarrhea and due to stool frequency, then the research that was done specifically was able to help with weight gain, specifically in that area, and not necessarily broadly increasing weight in the general population. So I think that's where I wanted to clarify based on that particular clinical trial I shared. Yeah.
Okay, thank you for that clarification. There's also an open question. The person wants to find out that based on all that have been said today, would we recommend probiotics, or would we recommend that our patients be given probiotics after antibiotic treatment or whilst they are on the course of antibiotic treatment? So should it be alongside the treatment or after the treatment with antibiotics?
Okay, thank you very much. It can be together, or you can do it after. Any way works. Now, what people, if you look at some of the, for instance, the Esbuladi, if you look at its characteristics, it is resistant to a lot of things, even the effect of antibiotics, because it's an antifungal. So, although with this short duration in the gut, it is able, through its immune-mediated actions, able to help with the stabilization of the dysbiosis. So, such a patient, in such cases, you can give both at the same time without. Now, there are other probiotics that are mainly bacteria-based, and some of them may be susceptible to the antibiotics that are given. So, in that case, what you do is you finish your treatment and then you use the probiotic to kind of establish your eubiosis. Thank you.
Okay, so Dr. Georgia, if I got you right, then what she's saying that if the person is given a yeast-based probiotic, then regardless of whether he's taking it during the course of the antibiotic treatment or after, it doesn't make any difference. But if it happens to be maybe a bacteria-based probiotic, that is when it should be taken after the course of the antibiotics.
Yes, because of the content. If the antibiotic is going to destroy it, then why the need? So you need to finish that. But as I said, antibiotic and fungus, there's no way the antibiotics can affect the fungus. So that can be done together.
So I think that this point that you've just answered raises a very good scope for the use of a yeast-based antibiotic like Esboladi or Normagut, because here you don't need to wait till the person is done with the antibiotic therapy before initiating the probiotic. It can go alongside with that, and you're rest assured that the drug is not going to be inactivated in one way or the other. Okay. This question says, how do I tell if I have developed dysbiosis, especially in the absence of obvious gastrointestinal conditions?
Honestly, I don't know either. Yes. So that is why we say that use it when needed. Okay. So for instance, you think that you've had diarrhea, anything that you think has distorted that, yes. But as a healthy person without any problem, I don't think. And please, the fact that, for instance, we talked about the gut brain axis, the anxiety, depression, etc., doesn't mean that when you take probiotic, it's one of the factors. There's usually most of these diseases, it's multi there are different things causing, when in terms of the etiology or the pathogenesis. Okay, so one of it is the dysbiosis we're talking about. So the probiotic is not the panacea for every disease, and then, as we said, should also not be used as prophylaxis. Thank you.
Okay. So
Okay.
thank
So
you
I
very
just
much.
also want to add,
Okay.
yes, just like she said, remember I showed a study where children who have had diarrhea were given S-Buladi. It actually improved the gut microbiota. But then the same effect cannot be said for somebody who doesn't have any of that risk factor. So again, this also goes to strengthen the fact that you don't need probiotic as a form of prophylaxis when you have a balanced or you normal gut microbiome. The other thing I had wanted to say in relation to, I think, the last question, I've even forgotten. How do I remind me? I didn't write it down.
The last question I remember was the person wanting to find out how can he determine
Tell
if
whether, yes, he has
dysbiosis.
dysbiosis. Okay. So the risk factors for dysbiosis, are they there? We spoke about drugs, which is antibiotics, stressful life conditions, change in diet. If you have any of these or a combination of these, then you are likely to say that, okay, I have possible dysbiosis, which may not be GI related. Then maybe you can take for a couple of days. But remember, Normagut or S-Buladi doesn't stay in the gut system for long. 5 days, you are good to go. Once you have the risk factors, I think it shouldn't be bad for you to take S-Buladi as a form of short prophylaxis once the risk factors are there.
Thank you very much. So I think we are just about winding up, and I just want to do a quick summary of all the things that we've said. Number one, I think we talked about the fact that our gut microbiome is formed, and the factors will be during birth, diet, external factors. These are the things that can contribute to the formation of our gut microbiome. Yes, we also talked about the fact that Normagut, or which is S-Buladi, performs 3 functions. We talk about the luminal function, the trophic function, and the metabolic function. And he went ahead to talk about the fact that Normagut will give you 3 benefits. It will stop your diarrhea, restore the normal gut flora, and normalizes to consistency and frequency. And that the unique benefit of Normagut is, number one, is that it's freeze-dried. And because it is, stability, viability, and rapid solubility is enhanced. It's also non-pathogenic, so it can be given alongside your antibiotic and all that. This is what we talked about, and that in conditions like antibiotic-associated diarrhea, in antibiotic-associated diarrhea related to H. pylori, in IBS and acute diarrhea, Normagut can be given. However, in cases like chronically or critically ill patients, immunocompromised patients, and patients with central venous catheters, Normagut is not preferred for such patients. Someone wants to find out how much Normagut is. So for a capsule of Normagut, it is going for the retail price of around 6 to 7 Ghana cedis per capsule of Normagut for you. It comes 30 capsules in a box. That's a pack of 3 by 10s. But per capsule is around 6 to 7 Ghana cedis on the retail market. So if there are no more questions, I would like to say a very big thank you to Dr. Adweji.
Well, I think I have a question.
Okay, please.
My question is the Normagut. Do we have the syrup? Do we have the sachet? Or it's just the capsule? And how do the children get access to this? And then if the next point I would want to make is that if you have to take your antibiotics with your probiotic, then you also have to look at the timing. Maybe you take your antibiotic 2 to 3 hours later, then you can take your probiotic, but not to usually not together. because studies have shown per the American College of Gastroenterology that it can be done together, but the time interval is important. Thank you.
Okay, so I think that was a very good intervention. That yes, in as much as you want to take it with your antibiotics, there should be separation at the time of administration. So maybe once you are taking it, you can take your Normagut 2 hours after your antibiotics. That's what I got. And doctor wanted to find out the Normagut. Do we have a syrup for kids, or do we have sachet for kids and all that? Okay. Currently, or Neil, would you like to take it?
Yes, I would like to take it. So, as I said, Normagut comes in an innovative freeze-dried form. That is an innovative German technology. Because of that, it comes in an innovative capsule form. The reason is that, you see, when you have S. boulardii, because it's a fungal spore, when it comes in the sachet form, okay, and it is not lyophilized, what happens is that in our very humid conditions with sporadic temperature ranges, the fungal spores easily coalesce. That significantly affects the solubility. So when you have to dissolve it in the milk for children, it affects the solubility, it affects the taste, and the fungal spores or the yeast spore, they easily mold when it's in the sachet form and it is not freeze-dried. And that's the reason why ours comes in an innovative capsule form that is very easy to twist, pour in the milk, because it has very high solubility and it doesn't have that bitter aftertaste. So it makes it very compliant for children to take it. So that's how come ours come in an innovative capsule form that is easy to twist and mix in the milk or the express breast milk of children, and it's very easy to take. It could also be taken in the capsule form for adults because it is in an innovative small capsule form that is easy to swallow for adults. But for children, because it comes in the freeze-dried form, there's better stability, better viability, better efficacy, and then much higher and rapid solubility when you have to mix it in a cereal for children or in an express breast milk or in their formula. So that's what answers that question in regards to how it comes in.
Okay, so in short or in summary, yes, it doesn't come in a sachet or a solution form. It comes in a capsule form. All that you need is twist the capsule, pour the content in the child's food, and you are good to go. And he gave us the reason for that, to ensure stability, viability, and even rapid solubility of all that. So I was just about wrapping up to say a very big thank you to you, Dr. Adjoeje and Dr. Taiba Jibril Afar. We are very, very grateful for such insightful presentation and education on dysbiosis. And I know that everyone who stayed up till now has been educated so much about what dysbiosis is, what are the causes, what are the treatment options, and why in the management of dysbiosis, S. boulardii is very, very, very critical. And when you talk about S. boulardii, you need to talk about Normagut, because that is the freeze-dried form of S. boulardii on the Ghanaian market. Thank you so much, everyone, for spending your precious time with us. This has also been another educative program for Mega Life Sciences, the company that cares for you and your patients. So until we meet again on another thought-engaging webinar, have the best of the day. Good night. Bye.